Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Warfarin. Review for current users. Pediatrics. Introduction. Blood clots can happen in children who have problems with their blood vessels, or heart. Blood clots may be dangerous. They may lead to the loss of a limb, strokes, or death. Your child's healthcare provider may ask your child to take a blood thinner to help prevent harmful blood clots. Warfarin is a blood thinning medicine. In spite of taking the prescribed amount of warfarin, factors such as illness, diet, exercise, and other medicines may affect how thin the blood is. If your child's blood is not thin enough, blood clots inside the blood vessels and heart may form. If their blood is too thin, they may be at a higher risk for bleeding. Controlling your child's INR. Your child's healthcare provider will take a small amount of your child's blood to check whether the dose is correct. This is called an INR test. You may also hear this test called a ProTime test, PT test, PT-INR test, or prothrombin time test. INR is the number that tells your child's healthcare provider how thin or thick your child's blood is. The prescribed amount of warfarin should help keep your child's INR within the acceptable limits, but things like illness, diet, exercise, and other medicines may affect how thin the blood is. This is why your child's healthcare provider will ask you to have your child's INR checked regularly. There are several things you and your child can do to prevent sudden changes in their INR and keep their blood as thin as it should be. To keep your child's blood as thin as it should be, your child should take the dose of warfarin prescribed by their healthcare provider at the same time each day. Keep their eating habits regular. Keep their exercise level regular. Have their INR checked regularly. Check with your child's pharmacist and primary healthcare provider before giving your child any new medicines, especially over-the-counter medicines, antibiotics, vitamins, and herbal products. Talk with your child's healthcare provider about products with aspirin. Do not give your child aspirin-like products such as ibuprofen, Advil, and naproxen, Aleve. For over-the-counter pain relief, talk with your child's healthcare provider about using acetaminophen. Tell your child's healthcare provider about any new or unusual symptoms. Your child should follow their healthcare provider's instructions when taking warfarin. If they miss a dose of warfarin, do not let them take an extra pill. However, it can be taken within 12 hours of the missed dose. Keeping regular daily activities the same, such as consistent eating and exercise habits, will make it less likely that your child's healthcare provider will need to change your child's dose of warfarin. Because children on warfarin are more likely to have internal bleeding with injuries, your child should not play contact sports such as boxing, football, hockey, soccer, wrestling. Check with your child's healthcare provider before your child starts a new exercise program or sport. Because having too much food with vitamin K in your child's system may lower their INR, it is important to keep the amount of vitamin K in your child's diet steady. Foods high in vitamin K are beef or pork liver, broccoli, kale, spinach, Brussels sprouts, asparagus, collard and turnip greens. If you have any questions about other foods, check the Warfarin manual or call your child's primary healthcare provider or pharmacist. The amount of green and leafy vegetables your child eats should not change. They should eat small amounts consistently. If your child chooses to drink V8 products, he or she should drink them on a regular basis. Grapefruit and cranberry juice should be limited to 8 ounces or less a day. Alcohol should be avoided as this can affect warfarin. The more similar your child's activities and exercising habits are each day, the less likely it is that their healthcare provider will change the amount of warfarin they take. It is important to have your child's INR checked regularly. Your child's healthcare provider will tell you how often your child should have this blood test done. Some children can check their INR at home. Once your child's healthcare provider gets your child's test results from the lab, he or she will tell you whether you should increase or decrease the amount of warfarin your child takes, and by how much. Make sure to tell your child's healthcare providers, even their dentist, that your child is on warfarin. Taking warfarin during pregnancy raises the risk of birth defects in the fetus. It can also cause excessive bleeding during delivery. If your child may be pregnant, talk with your child's healthcare provider. Your child should be careful when using knives. Razors and hard toothbrushes can cause bleeding. Have them use an electric shaver and a soft toothbrush instead. Children who are on warfarin should wear a medical alert charm. This is very important in cases of medical emergencies when you and your child are not able to communicate with your child's healthcare providers. When to call your child's healthcare provider. Certain side effects of warfarin are normal, such as chills or feeling cold, feeling more tired, bruising more. If these side effects become severe or do not go away, call your child's healthcare provider. Even if your child is taking the prescribed amount of warfarin, dangerous internal bleeding or blood clots can still happen. It is important to tell your child's healthcare provider about any signs of internal bleeding or blood clots. This section will teach you about when you should call your child's healthcare provider. You or one of your family members or friends should call your child's healthcare provider if your child has a serious fall or hits their head. This is very important if your child starts to have a headache or if they become sleepy or weak.
If you or your child notices any blood in their urine, pee, or stools, bowel movement, call your child's healthcare provider. Blood turns urine red, pink, or tea-colored. Blood in stools can turn the stools dark red or black. Your child's healthcare provider may want to check that your child does not have internal bleeding in the digestive or urinary systems.
If you or your child notices unusual bruising, large areas of bruising, or black and blue marks on your child's skin for unknown reasons, tell your child's healthcare provider. This may mean that your child is bleeding under the skin. Small bruises that result from minor accidents, such as a leg hitting furniture, are normal and you do not need to call your child's healthcare provider. Check with your child's healthcare provider if your child experiences dizziness, trouble breathing, chest pain, or if your child feels weak or more tired than usual. These can be signs of blood loss and anemia. Call your child's healthcare provider when there is bleeding that does not stop from a cut or from your child's nose. Call your child's healthcare provider if the bleeding does not stop after about 7 minutes. Call your child's healthcare provider right away if your child experiences a rash, hoarseness, hives, itching, swallowing problems. Call your child's healthcare provider right away if your child experiences flu-like symptoms such as diarrhea, loose stools, nausea, feels like they need to throw up, vomiting, throwing up. Call your child's healthcare provider right away if your child has an infection, loss of appetite, pain in the upper right side of the stomach, yellowish eyes or skin. Call your child's healthcare provider if your child's hands, feet, ankles, or lower legs are swollen. Tell your child's healthcare provider if your child notices more bleeding than usual when she gets her menstrual period or if she has bleeding between periods. If your child has a high fever or an illness that seems to be getting worse, call your child's healthcare provider. You should also call your child's healthcare provider if your child notices any blood when they cough or vomit, or if they have loose or runny stools, diarrhea, or an infection with high fevers and chills. If your child experiences pain or swelling in any of their joints, check with your child's healthcare provider. This may be a sign that your child has bleeding inside of a joint.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Healthcare providers prescribe a blood thinner to help prevent harmful blood clots. Warfarin is a blood-thinning medicine. If your child's blood is not thin enough, blood clots inside the blood vessels and heart may form. If their blood is too thin, your child risks a longer bleeding time. The prescribed amount of warfarin should help keep your child's INR within the acceptable limits. But other things like illness, diet, exercise, and other medicines may affect how thin your child's blood is. For this reason, your child's healthcare provider will have your child's INR checked regularly. To keep your child's blood as thin as it should be, your child should take the prescribed amount of warfarin at the same time each day. Keep their eating and exercise habits regular. Have their INR checked regularly. If your child misses a dose of warfarin, do not let them take an extra pill to catch up. Certain side effects of warfarin are normal, including bruising more easily. Small bruises that result from minor accidents such as a leg hitting furniture are normal and you do not need to call your child's healthcare provider. If you or your child sees signs of internal bleeding such as dark urine or stools, call your child's healthcare provider right away. Thank you for using Explain.